Welcome back to the second video. We are going to continue our very interesting conversations with ma'am. Hello ma'am, welcome back. You have seen neuropathology at a global level. You are a visionary in that. But how do you think we break it down to bring the care or bring the knowledge of neuropathology to Indian subcontinent?
So, yeah, this is quite a complex question, how to bring it down to the Indian context.
Because I feel there's a gap, ma'am.
There
That's
is
why
a
how
gap.
do we bridge
Yeah,
the gap
yeah.
there?
How do you bridge the gap? So, we'll talk about first diagnostics.
Okay.
We'll talk about diagnostics. So, I mean, now we know, I mean, what we are, right now we, all of us follow the WHO classification of tumors. Look at our own country. Our country has very diversified resources.
Yes.
There are centers where you can do the molecular testing, but there are many centers where you can't do it, you know. So, there should be some sort of a bridge between scientific advancements and resource availability.
Yes.
Isn't it? We need to bridge that. So, in order to do that, we started this society known as the Asian Oceanian Society of Neuropathology, and in that society we have started an initiative which is known as ADAPTER.
Yes.
ADAPTER is adapting diagnostic approaches for practical taxonomy in resource restrained regions. Okay? And the aim of the ADAPTER is basically to provide practical recommendations for different resources levels, different resource levels, which is just an adaptation from WHO. We are not creating a parallel system, but it's an adaptation of the WHO CNS5 guidelines. So, for that what we did was we divided resources into 5 levels.
Okay.
RL1, resource level 1 to RL5. So, RL1 centers are those which are very low resource level centers, which probably have just some histopathology, maybe a few special stains. At RL2, there is the availability of basic diagnostic IHC markers, say GFAP,
Okay.
Ki67, you know, CK, pan-CK, a few IHC markers. At RL3, there is availability of surrogate IHC markers,
Okay.
like IDH1R, 132H, ATRX, H3K27. I mean, these are surrogate markers. And at RL4, the centers are equipped to perform basic molecular testing.
Okay.
Say, for example, PCR or, you know, FISH, and then DNA sequencing. RL5 are the most advanced laboratories where high throughput techniques are available. NGS, methylation profiling, nanostring, everything is available. So, we wanted to assess the availability of resources in the different regions of Asian Oceanian countries, and so what we did was we carried out a survey.
Oh.
And that included 19 countries from the Asian Oceanian region. And from our neuropathology society, I would like to talk about neuropathology society as well. From the society, we carried out a survey in our own country, 52 centers for neuropathology diagnostics. You know that many general pathologists, they are doing neuropathology, isn't it, as a part of their routine.
Yes.
So, we noted that in more than 70% of cases, the centers were ranging from RL1 to RL3. Maximum was surrogate markers. RL4 was in a fewer centers where basic molecular testing was being carried out, and RL5 was almost not available. And so, we are proposing a sort of a histology oriented integrated diagnosis format and diagnostic flow charts that will suit these resource levels. And our recommendations are basically on histopathology and immunohistochemistry. We recommend molecular testing only when it is required.
Okay.
And I am very happy to tell, we are doing this for many groups of tumors. I am happy to tell you that our first recommendation on adult type diffuse gliomas, it's in press in the journal Brain Pathology, and it will be soon available via the PubMed. So, that is what is happening. That is as far as the diagnostics are concerned. Now, regarding education, bringing in neuropathology knowledge within the country. You know, neuropathology was initiated way back in 1950s. Professor Dastur was the first pioneer of neuropathology in the country.
In India.
Then came some stalwarts who took it forward. Okay. In the year 2015, we started this Neuropathology Society of India, because there were several general pathologists who wanted to be more educated in neuropathology because they're seeing cases every day. So we started the society with that in mind, and we had I'm one of the founder members. We had very few members at that time. Now we have more than 250 members in the society. And over the years, I mean, there have been many stalwart neuropathologists who have been presidents of the society. Professor Sarla Das, late Professor A.K. Banerjee, Professor V.V. Radhakrishnan, and then late Professor Shankar, Professor Sundaram, Professor Chitra Sarkar, myself, and now it is Professor Radotra who is the president of the society. So, I mean, the goal is to educate neuropathology to different pathology communities and the clinicians. So, we have lot of national conference, traveling school of neuropathology, which we have now called it as national CME, webinars, and then we have resource persons. We have joint teaching programs with other societies, clinical societies. We have resource persons who go to other societies, even to state chapters of pathology and microbiology, IAPM. We have got resource persons who go from the society and they give lectures, and then they conduct workshops and they educate the general pathologists in neuropathology. So, we want to spread the awareness of neuropathology in the country, and I think our society is doing a lot, and I am very proud that some of the members of the society have contributed extensively. We are almost there in the global community because we have contributed extensively. We are some of us are authors of the Blue Book of WHO and even of Greenfield and other neuropathology textbooks as well. So, I think this is where we are going with neuropathology in the country. So, we are trying to bridge that gap. We are trying to see that, it's not a niche subject that nobody can, touch it or something like that, but we are trying to spread the awareness and the knowledge. How can you diagnose even if you don't have those resources? It's not very difficult and you can do it. So, that is our goal in this.
Absolutely, ma'am. As you explained it so well, this is what is required for our country specifically, because we do lack most of the cities do not have RL5 or even RL4 level resources. So, I think as you said, it will be wonderful to have such. And I cannot wait for the, it's an entire book, ma'am, that you've written?
No, it's our recommendation in the form of a manuscript.
Okay.
So, it will be it's in press. It'll a couple of weeks from now it should be out in the PubMed.
I cannot wait to read that.
Yes, please read that because we put a lot of effort in that to give guidance to pathologists and general pathologists how to go about to diagnose these cases and what terminologies you should use. Basically, what are the terminologies that you can use, and with those terminologies we provide a comment so that the clinician knows how to go about to treat the patient at a particular resource level. I mean, I know that moleculars have come up in a big way, but it should go hand in hand with what is being available for treating patients also, isn't it?
Yes, ma'am.
Because we don't have too many targeted therapies. It is there, but for CNS tumors, very few targeted therapies are now becoming available. I can't even say that they are available. They are becoming, and they are very expensive for patients. Affordability is a big thing for the patients.
Hopefully, in a decade or two, I think all of this will be included in government schemes so that patients do not have to face financial problems while getting treated.
Yeah.
Moving away slightly from our line of discussion, what is your favorite spot in NIMHANS? You've been there for so long, I'm sure you've had one or two spots that you would want to go sit there peacefully to relax.
That's a difficult question to answer. My favorite spot was in my chamber itself.
Okay.
I loved my chamber.
Okay.
And most of the time I would be there in my chamber, but for going for other activities like if you want to go for your surgical reporting, you have to go to the discussion room. If you have to go for brain cutting, you have to go elsewhere. So that used to be there, but I would come back to my chamber, and I liked my chamber quite a bit. And me with the other professors, we were everybody is very friendly over there. We would have lunch together.
Oh.
Yes, we would have lunch together. We had, I think for more than 35 years, I've taken my dabba for lunch to the department. So with the other faculty members who also brought the lunch there, that was the most relaxing hour, the lunchtime. So we used to talk about non-neuropathology things, you know, just talk about other things, which was very relaxing. So I think that was a very different experience. It was a nice experience, and having lunch with my colleagues, that 1 hour we used to, it's not 1 hour, half an hour to 45 minutes, but that was very relaxing. In this whole day of stressful work, you know, a little bit of relaxation used to be that, yes. But it was fun really. I'll tell you that my stay there was not always so professional, work related. We did have a lot of fun times as well, particularly when we started with the junior faculty coming in. You know how, just like you, they're so cheerful, so charming. And we had students, and it's a different ball game when you have students, you know, they know how to make it very light. Yes. So we used to have fun times as well with the students, celebrate the birthdays, you know, any single event, we would celebrate that, so that, you know, it's a break from routine work. Even if you get few samosas or you get a cake or whatever it is, but it was lots of fun. So fun times were there during my work. Even now, post retirement, I think I've just superannuated from NIMHANS, but not from neuropathology.
Definitely.
So even now I do my private consults at Aster Lab in Bangalore. I go to Aster Kochi at Aster Medcity Kochi. Very fond of my younger colleagues, both at Bangalore and at Kochi. And I'm seeing a different world actually, and they tell me different things. So I do enjoy that a lot. I do enjoy.
After your work, after a long day of your work, how would you relax at home, or how do you unwind? At college?
So the way that I unwind is to go for a walk in the park. There's a lovely park near my house, and I love to go for that evening walk. And that 1 to 1.5 hours is my time. And I have a lot of walkmates. Oh. They're all in the neighborhood.
Okay.
They're all ladies of the neighborhood, and most of them are non-medical. And so we have a lot of fun walking together. We talk about many things. I mean, you know, of course we talk about health. We are growing older, so everybody talks about health. And then we talk about yoga, meditation, food, Bollywood, jewelry, all kinds of, sometimes even very mundane things, maids, or you know, what's happening at home, or why the road is like this. And you know, we talk about many things, but it's so relaxing that once I come back, I don't even remember. The next day, I don't remember what we spoke about. So that's the most relaxing. I think that's the way I unwind, and I love to go for a walk.
Ma'am, what qualities do you think trainees or students should have to make good researchers?
Yeah, so I have worked with a lot of students. I have trained at least about 7 PhD scholars have graduated under my guidance, and DM candidates as well. And I've guided a lot of you know, postdoctoral fellows, and then those who came to do their MD theses, and a lot of neurosurgery students, you know, and they were pursuing their MCH. And so what I found in all this was, there's only a subset of them who are extremely brilliant, and I see these qualities in the making of a great researcher. You see, in a student, they can perceive their research topic very well. They understand it very well. That is point number 1. You see, they have an analytical mind. Point number 2. They put forth their own hypothesis. They design their experiments, and they carry out those. All that I had to do was to look at the results and to advise and to kind of correlate. So basically, I was an advisor, not really their guide, you know. And I think these are the qualities to make a great researcher subsequently. And all these very brilliant students of mine, they've graduated, and they have been placed in very great big institutes in Bangalore, at NIMHANS, outside of NIMHANS, abroad, so many of them are abroad. And I can tell you that I am very proud of them, and I am so happy that I have learned from them. You see, a teacher should also, when you teach, you also learn. The more you teach, the more you learn.
Yes.
Isn't it? So I have learned a lot from these students, and I am very happy to have had that, to be so fortunate to have such students with me. I can say that.
You've had so many roles as an administrator, a diagnostician, a researcher. Which of these do you think impacts the legacy that you are leaving for the younger generation?
I think all of them. All of them. And I've loved my diagnostics. I have a great passion for it. And of course, teaching. It's very close to my heart. Teaching is very close to my heart. I've been a teacher for many, many years. And research, that's been a part and parcel of me, to conduct research, to identify new markers, to, to bring meaning into something. So I wish to be remembered for all.
I have a bouncer question here. What's your favorite food?
Oh, my go-to food is masala dosa.
Oh, wonderful. Masala.
I've loved it ever since I was a child, and I love it even now. When there is a buffet spread out, when we go for conferences, when we go for a wedding, so I'll just have a look and see whether there is a live counter somewhere
Masala dosa.
with a masala dosa. So I don't take anything else. I
Okay.
just make a beeline for masala dosa, and I truly love it.
Is that a Bangalorean thing, ma'am?
Very Bangalorean.
Hello?
Very Bangalorean.
Yeah. What inspires you every day to keep continuing in this field of neuropathology?
I think there are three things that inspires me. One is purpose. The second is joy, and the third is growth. Purpose. I should have a purpose for my work. There should be a meaning for that. Even if I give a single report which is meaningful and makes a difference in the patient care, helps patient care, that will inspire me a lot. Joy is the second thing. I'm very passionate about my work. I get up in the morning telling myself that I have so much work to do, I need to see my cases. As long as my brain is healthy, I think I'm going to be involved in my work. So I'm very happy doing that, and that inspires me a lot. It's not like you get up on a Monday morning and say, oh, I have to go back to work. It's not like that. I love to go back to work. So you have to be passionate about what you're doing, and then you will be inspired to do it. And the third, of course, is growth. It has to bring some growth in your profession, and it has for me, and that inspires me further. So these are the three things that truly inspire me on a day-to-day basis.
Can you tell me something about your family?
Yes, Apoorva, I am very proud of my family. I already spoke about my husband, Dr. Santosh Kumar. He's a well-known pediatrician for many years here in Indiranagar. We have one son, Nikhil, and he graduated from the RV College of Engineering in Bangalore and pursued his master's in robotics in Carnegie Mellon in the US. Subsequently, he got his PhD from University of California at Berkeley. He is now an entrepreneur. He has his own AI-based company in the US. And we are very proud of our daughter-in-law. She is Brandy Lipton, and she is also a PhD in economics and is now an associate professor of health economics at the University of California at Irvine.
You have delved into all the complexities of human brain. What advice would you like to give to the younger generation so as to keep our brain safe?
Well, I can say that keep your brain actively engaged and keep your body healthy. So how do you keep your brain actively engaged? I don't have to tell you or any other pathologist. We are always very active thinking about how to solve a puzzle to give the diagnosis, isn't it?
Yeah.
Pathologists' brains are very active. But otherwise also, you have to keep your brain very active. Maybe with whatever you like, reading, learning new skills, solving puzzles, music, anything. Getting into conversations. So keep your brain actively engaged. and keep your body healthy. That is very important, and everybody is talking about it these days. So you have a healthy lifestyle, a balanced diet, a good sleep, and a sound sleep, I should say, and of course social connections. I think if you kind of amalgamate these two, your brain will be strong and safe.
It was lovely speaking with you. Thank you for sharing your valuable insights, and we wish you very all the best, and we hope you have continued success for the future. It was lovely to speak with you so much.
Thank you very much, Apoorva. It was wonderful to talk to you.
Thank you.
And wonderful to be in this forum as well. And I'm really privileged, I'm honored that you have selected me to be a part of your PathVarna, and I'm very happy to be participating in it. Thank you so much.